Having a baby is a very exciting time, but it is also a time of confusion, and sometimes it's a little bit daunting for, new mums to be, and especially when everyone wants to tell you their horror birth stories. I don't know why people want to do that, but it is important to remember the facts of labour. So please tell me, Dr. Liz, what are the 3 stages of labour?
So there are 3 stages, but some of them are broken up into a couple of Part A and Part B. So the first stage of labour is where you've got latent and active. Latent's where you have a slow increase in your Braxton Hickses. Active is when you have painful, regular contractions, and if they're happening frequently enough, they start to dilate your cervix. And from when you're 4 centimetres dilated through to fully dilated, that's the active first stage of labour, when you normally go about 1 centimetre an hour. Fully dilated is 10 centimetres, and that marks the start of your second stage of labour. So the second stage of labour, there's also 2 parts to it. The first is where we give a little bit of time for what we call passive descent, which is where the baby's head just gets down low enough past the pelvic floor muscles. And the active phase is where we get you to push your baby out.
Okay.
So pushing and the delivery of your baby is the end of the second stage, and then we move into the third stage of labour where the placenta is delivered.
And sometimes the placenta is just as rough as delivering the baby, or no?
No, not normally.
But
you do just pass you've just passed a baby, so the area can be a bit swollen and tender.
Yes.
And usually sometimes we may need to rub your belly at the same time and do a few different tips and tricks to help the placenta come along, and that can, for some women, be a little bit tricky.
Yes.
But normally the passage of the baby's head represents the most
painful part.
The most tender part, yeah.
Most tender. It's not painful at all. It's actually like, just going to the toilet, isn't it? No. So, which leads me to, it can be a little bit painful. So, tell me about all the drugs.
Well, I like to tell women there's a hospital full of drugs, and there's a complete arsenal, and you can have whatever you like.
Okay.
So, but we do try and persuade people to graduate their way through, but some people, their birth plan is an epidural, and that's absolutely fine. So starting with, some people may use some
Panadol.
tips and tricks. Yeah, they can start with Panadol. They may, though, do a bit of hypnosis or just warm showers, a little bit of heat on the back.
Packs,
yeah, there's also
massage.
some TENS machines you can pick up from a physiotherapist and massage. And then we might move through to some Panadine or then we graduate onto some gas, so the nitrous gas, and then there's injections such as morphine or pethidine, and then we can move on to something more stronger such as an epidural.
Which pretty much blocks everything from...
Yeah, sometimes it can be a little bit variable, but for the most part, for most women, it provides very, very effective pain relief. But the compromise to that is that we need to more intensely monitor your birth. So we have a trace on your baby's heart, and also we put a drip in your hand, and the epidural itself will usually, unfortunately, mean that your motor function, so getting up and walking around, is not possible.
So so obviously, things do happen during labour, and it means you have to have an emergency C-section, or you've elected to have a C-section in advance. What are the pros and cons of that then?
So some advantages to a Caesar include, if it's an elective procedure, that means you can book the date, and you know the date, the time of your delivery. Also, if you've previously had a birth outcome that you wish to avoid, so if you've had maybe a tear or you've got pelvic floor dysfunction, some people have medical conditions which indicate that they might be best off if they had a Caesar. But the other thing is that some people, it's their birth choice, and that's not unreasonable. We do try to persuade, particularly first-time mums, to consider vaginal birth. The cons of a caesarean section include that it is major surgery, that it does have a slightly longer recovery compared to a vaginal birth. So, for example, driving, we advise you not to drive for a period of time after a Caesar. And then we have also some disadvantages. There is a slightly higher rate of blood loss, for example. There's a risk of infection along the wound line. So surgery does carry some risk as well. With respect to the baby, in Australia, birth outcomes are generally pretty good for vaginal birth or caesarean section for the babies. We have a great healthcare system, so we can usually manage that either way. So yeah, there's pros and cons, choices with all things in life, risks and benefits. But I think at the end of the day, what people choose to do with their birth and their body is a very personal choice. And some people are very pro-vaginal birth, some people are very pro-Caesar, but for the individual woman, it's just important that you choose what you want to do with your body. And if people hold particularly strong thoughts and feelings, maybe persuading them to not impose
Judge,
and judge, that'd be an advantage.
Advantage to a mum who's already going through a lot, because let's face it, it is up to what is the best for the baby and for the birthing mother. So in the long run, so childbirth is different for every baby and every mother. So try not to get too anxious if you're out there and you're about to have a baby, and your baby will be in your arms before you know it. So if you are after a wonderful obstetrician, you can certainly contact Dr. Liz and her amazing team today to see how they can support you through this very exciting event.